We'd like to start off by thanking everyone who has joined us at this webinar today. Welcome back to those who turned in last week, and for everyone who was unable to join last week, we're happy to have you here. My name is Killen Tang, and I'm actually a public health research intern for COVID-19 Greater Charlotte Area Mutual Aid, or COVID-GCA for short. COVID-GCA is a mutual aid organization that was launched on March 18, 2020 in response to the COVID-19 pandemic. The mission of the COVID-GCA is to serve individual and community needs during the state of local, national, and global emergency. We aim to accomplish this through consolidating available resources in the community, connecting assistance to those who are immediately impacted by the coronavirus, and facilitating the distribution of aid through this collective effort. The impacts of this public health crisis on our community are manifold, with homeless shelters experiencing shortage of supplies, local businesses going under, and individuals left in compromising, vulnerable, and isolating circumstances. In response, we hope to create a platform where members of our community can help each other and uphold solidarity to alleviate the wider financial, social, and emotional ramifications felt by the Greater Charlotte area. To spread awareness about COVID-19, we've organized a public health webinar series titled 5 Weeks to Better Understanding COVID-19. Each week will feature a different topic, which includes remote learning and return to school safely, facts and fiction about COVID-19, mental health and COVID-19, school athletics and COVID-19, and finally, the economy and the job market. These webinars will be held weekly on Wednesday evenings from 6:30 to 7:30 p.m. Eastern Standard Time and will be streamed live or posted later to Facebook. Joining us as well is a cohort of CMS high school students who are eager to learn more about the pandemic and how it is affecting our lives. By the end of the 5-week series, the students will write a policy brief that will be presented to the CMS Board of Education, detailing their recommendations for how schools should proceed in the fall. The topic for this week is facts and fiction of COVID-19, and it is our honor to present to you our guest speaker, Gibbie Harris. Ms. Harris is the Public Health Director for Mecklenburg County. She manages public health and environmental health activities and provides vision and direction for all public health activities throughout the county. She's become the face of the local government response to the COVID-19 pandemic today. And again, on behalf of everyone here at COVID-GCA, I want to thank you for taking the time to be here with us today. And welcome to Ms. Harris.
Thank you. I appreciate the opportunity to be here. I'm kind of surprised that your CMS students are online because the school board's meeting right now to decide what to do about school in the fall. They have an emergency meeting tonight. I just came from there answering some questions for them. So by the end of the evening, you may have some idea about what school's going to look like in August. But anyway, I appreciate the opportunity to talk to y'all tonight. I've got to be honest, I had not heard of this group before. I'm pleased to know about this group and the work that y'all are doing in our community. It's really important. I commend you for getting involved in that way and being involved in this work. I thought what I'd do this evening is take a few minutes to give you sort of an overview of where we are in the pandemic, a little bit about COVID, and a little bit about how the community has sort of responded up to this point in terms of the typical response to an emergency in Mecklenburg County, and then open it up to any questions that folks might have. Sometimes the questions are more interesting than what I have to share. So if that sounds okay, I'll just kind of move ahead with that. So everyone knows that the first case in Mecklenburg County was back in early March. We had been watching things that were happening across the world, starting to think about what we needed to do in Mecklenburg County to address this issue. As you likely know, COVID-19 is a respiratory virus that spreads, we think, mostly through droplets, but there is some concern at this point that it may also be aerosolized. And the difference is droplets are larger. They're still not something that you can see, but they're larger and they're heavier, so they don't carry as far. So when you breathe out or you cough or you sneeze or you sing or you yell, those droplets will come out of your mouth and will spread. But because droplets tend to be a little more heavy, they will fall fairly quickly. So that's why we say the 6 feet of social distancing is in the research they've done, is that's how far those droplets typically travel. What we are concerned about is the potential for this to be more aerosolized, which means it's much finer and it carries further. It doesn't fall as quickly. But all of the research right now is showing that there's less chance of transmission when it's aerosolized. So that's not as much of a concern. But when you hear me talking about people wearing masks and needing to wear masks, it's because that's how this is transmitted. If we can stop most of those droplets with the mask, then the chance of transmission goes way down. And when everybody is wearing a mask, it really makes a difference in our community. So you'll hear me over and over and over again pleading with people to wear their masks when they're out in public. So back in March, we actually opened the Emergency Operations Center here in Mecklenburg County. It has been open since then. It's the longest, I think the longest deployment they've had here in North Carolina for any emergency operations center. And what that does for us, number one, there's a declaration of emergency that's declared in the county. It allows for funding from FEMA and the federal government to come in through the state to Mecklenburg County to help support the work. But it also brings lots of different partners together to work together on this. In that center right now, we have law enforcement, both from the city, the county, as well as many of the municipalities. We have fire and rescue in there. Our medic folks are in there. We have schools. We have both hospital systems. Let's see, public health is there. Health and Human Services is there. And our joint information center is in there that helps get word out and deal with the press. So it's an opportunity for all of these folks to work together to develop a plan to address things in our community. And one of the groups that's been most useful during all of this is our VOAD group, which volunteers during disasters is basically what that means. So I'm wondering if I need to connect your group with VOAD if you've not been connected, because they've been working with lots of different groups that do volunteer work in the community to try to coordinate that and making sure that we're leveraging our resources the best way we possibly can. So I just wanted you to have that concept of the Emergency Operations Center. Typically that opens when we have a hurricane come through or a flood or an ice storm or something like that. And it's usually short-lived. But because this has gone on this long and we still have a declaration of emergency in place, it's still open. Where we are with this virus in Mecklenburg County is, as you know, we had a stay-at-home order with the intent of flattening the curve. And because what we were seeing is our numbers were driving up fairly quickly, and we were concerned about hospital bed capacity. So we implemented the stay-at-home order. And if you look at our data, you can really see that the curve did flatten significantly. It came down and it stayed down while we had that order in place, which was important because, number one, it started slowing the spread of the virus, and it stopped the numbers that we were seeing in the hospital from climbing past the hospital's capacity. But the third thing it did is it gave our hospitals a chance to do planning and to increase their surge capabilities when we do see spikes in additional numbers. So as we come out of our stay-at-home order and people have started getting out and about again, our numbers have gone up. We're doing more testing. We're seeing when you do more testing, you find more. We know we've got community spread in Mecklenburg County. But what we watch more closely is our trends. That's what's going to tell us if we're getting into trouble. And one trend that we watch is our positivity rate. So of all the tests that we do, how many of them are positive? And we're hanging in the 10 to 11% range. That's higher than we want it to be. But it has been fairly stable. It's not going up. which is a good sign. And we also watch our hospital census, both acute beds as well as ICU beds. And what we're seeing there is there's been a steady but slow climb since about the middle of May. And as we've opened up and more people have become ill, we see more people in the hospital. Right now, the hospitals are able to manage that, and they do have a good bit of surge capacity at this point. So we're feeling okay about where we are with that at the moment. And I will say personally that the idea of going into lockdown again does not sit well. As we came out of that, people felt like they'd been released from jail and started doing things that weren't safe to do. There's still a good bit of that happening. And I understand the perspective, but at the same time, I'm concerned that if we close things down again, we'd have the same thing happen. We've just got to figure out how to manage this. And managing it is doing the things that we know help prevent it, which is wearing masks, social distance, wash your hands, and don't be out and about any more than you need to be. So we continue to drive that message, and that's how we as a community are going to get through this. The only other thing I'll say before I slow down here for a minute is that we've got flu season coming, and that's going to complicate things for us. We will see, we always see increased hospitalizations with the flu. We know there's still a lot of people who don't like vaccines, don't believe in vaccines, don't take flu vaccines. So we know we will have flu cases, and sometimes it's going to be hard to tell the difference between COVID and the flu unless we're able to test appropriately. So we know that's coming in the fall, and we just need to be prepared for that. So we are planning around that. We're trying to make sure that we have flu vaccine readily available. We're going to start educating people about that, and we'll have to watch where we are with our hospitals. The preference is not to back up, but to manage where we are and make sure that we continue to have the resources we need in place, because people need to work. We know the impact that this virus has had on our community from an economic standpoint, and the people who can least afford to do without a paycheck are the ones that are being hit the hardest. They're the ones that are losing their jobs, or their jobs aren't opened up, or they're working in essential services and they're getting sick and have to stay home. There's just any number of reasons why people need to work. And so we want our community to stay open. We want people to be able to work. We want our children to be able to go back to school. And it's going to take all of us working together to make that happen, because we don't have a vaccine yet, and we don't have a cure, and we have very little treatment. So we've got to do what we know works. Let's see, what else can I say? I mean, I think the other challenge that we've had, and y'all are experiencing this, none of us who are older than you have ever experienced anything like this. So we have had to learn as we go. The other challenge is we didn't know a lot about this vaccine in the beginning, and we're still learning. So what that means is guidance has been changing. The messaging has changed. People are confused. We don't have a good, strong plan or messaging from the federal government. So people aren't sure who to listen to. And that has created some challenges for us as well. So the CDC director was here this week. I had a chance to talk to him, and I told him, if there's anything you can do for me, get us a solid plan and strong, consistent messaging for our communities and for the country. That would have the biggest impact, I think, at this point in time. I'm not holding out great hopes right now that that's going to happen, but I did ask for it. So, and the last thing I'll mention is the whole issue of testing. We are trying to ramp up testing. We are trying to make testing really available. The increased testing we've been doing has created issues for our labs, who are backed up some. So sometimes it takes too long to get test results back. But I want to emphasize that we cannot test our way out of this virus. This virus will be with us for some time to come. And testing is important, but it doesn't solve the problem. People need to listen when they're told they need to isolate and quarantine, and they need to have the resources to be able to do that. And that's some of what y'all are doing. If I tell somebody they need to stay home for 10 to 12 days because they're sick, or 14 days because they've been exposed, I need to be able to ask them, do you have enough food? Do you have the medicine you need? Is there a problem with your rent? Do we need to talk to your boss? What are the things that we can do to help make sure that you can be compliant with the things that we need you to do? So testing is not sufficient in and of itself, and never will be. We've got to manage this infection, and managing it, part of managing it is people being able to work and to be able to bring home the paycheck so they can support their family. And it means our children being able to go back to school, because virtual learning works for some, doesn't work for everybody. And not all parents are created equal when it comes to homeschooling. I can tell you that for a fact. There are reasons teachers do teaching, because they have patience that some of us don't have when it comes to trying to teach our kids. So I think there's all sorts of reasons for us as a community to come together and be the solution around this. So I'm going to stop there, and I'm happy to entertain any questions that y'all have. If I don't have answers to the questions, I will make sure that I get them for you and get them back to you if those answers exist.
Hey, so thank you so much for all of this very important information. I'm sure that a lot of it was new. I certainly did not imagine a lot of the things that you said, but for the Q&A session, if everyone could go to the participants tab, and if you see the option to raise your hand, you can do that if you have a question for Director Harris. While we give people time to do that, I actually have a question relating to Charlotte-Mecklenburg Schools. So we recently had Chairwoman Elise Dashu come to us and speak to us about how CMS is approaching reopening Charlotte-Mecklenburg Schools. And I was just wondering what the nature was of, or is, of the collaboration between the Department of Health and Charlotte-Mecklenburg Schools. Is there like a very close relationship? Does there seem to be like a lot of guidelines from the CDC going into it? How is it working?
So I'll start at the end of that and then go back. So, you know, guidance comes from the CDC and from the federal government, sometimes in different ways, but that guidance comes down. And then there's guidance from the state. You got to understand that when the governor puts out orders, he's doing that for the entire state of North Carolina. So that guidance has to work for Mecklenburg County as well as it does for Graham County that has 9,000 population. So I tried to emphasize that tonight when I was talking to the school board, is you can't take verbatim what comes out of Raleigh. You have to take it and then you have to adapt it to your community to make sure it fits the needs here. I mean, we are the most populous county. We have the most numbers and have from the very beginning of any county in North Carolina. And our approach sometimes has to be different than some of the other counties. We take his guidance, and if he gives a specific order, what we know is that we can't do less than that order, but we can do more. So if his order, which came yesterday, was Plan B, which is up to 50% of the school can be occupied at one time, right? So 50% of the students can come back at one time, and they can, however they decide to do that, they could do every other day, they could do every other week, they could do every other month. School systems have the flexibility of how they want to do that. So that was his order, but that does not mean that the school system has to stop there. If the school system decides that it's better to go virtual completely, they can do that. But the school system cannot say, we're going to open full because the governor said the bottom is that 50%. So you need to understand that. In terms of how we work with the schools, a couple of things. My department houses the school health program. So we provide a nurse for every school in Mecklenburg County. So there is a school nurse assigned to every school. Now, we don't always have all of those positions filled. Getting that many nurses is not always easy to do. And not every nurse is cut out to work with kids in a school environment. So we have to make sure that we've got good fits. But we try to make sure that there is a school nurse presence in every school. So we have that working relationship that's ongoing with the school system. Around COVID-19, we have been involved with them since the beginning when they made decisions to close the schools. And as they have started looking at potential plans for opening, we've been at that table with them, providing public health guidance. I'm not going to tell them how to teach kids. That's not my area of expertise. But I am going to tell them, I don't think that would work well. And I think this is a particular issue, or I think that looks really good and a good way for you to be able to social distance. And these are some tools that you can use, the protocols for screening, the looking at how to teach kids about how to wash their hands, how to wear masks, how to social distance, all of those sorts of documents and things we can provide them. So we've been working with them all along. And I feel that the school staff really has the best interest of the students as well as the teachers and the staff as they've tried to develop these plans. So what the school, it's hard for me. I came out of I presented to them, and they had some more presentations, and then they were going to deliberate and make a decision tonight. I stayed long enough to talk with them and answer their questions, and then came back so I could be with y'all. So I don't know where they are with this, and we'll all find out tonight where they decide to go. But I reassured them tonight, whatever they decide, that we'll continue to be partners with them and work with them to make sure that they're doing their best to keep people safe while they're educating.
Thank you so much for that response, Ms. Harris.
Mm-hmm.
I think Mona has a question.
Hi, yes. I was wondering, how effective are normal antiviral masks against the virus, and what the difference is between antiviral masks and homemade masks?
So there's different levels of masks, and I think that's been confusing for people. And in the beginning, we said, don't go out and buy masks, don't do that. And at that point in time, we had very limited availability of personal protective equipment, PPE. And we wanted to make sure that those folks who were interfacing with individuals who were positive and infectious had the ability to protect themselves. So whether that was law enforcement, fire and rescue, medic, the hospital systems. So at that point, we were telling people don't wear a mask because we need to save it for these folks. As we've gone forward and masks have become more available, and as we've learned more about the transmission of this virus, we are requiring now for people when they go out in public to wear a face covering. Now, some people prefer the disposables, and that's sort of, there's the N95s, which is actually a respirator. So it has a function within it that actually cleans the air as it's breathed in. It is, the person who wears an N95 has to be fit tested. What that means is they put on a mask, and then different things are waved under their nose. Do you smell this? Do you smell this? Do you smell this? And until they can say no, that mask doesn't fit them well enough. So there's a specific, what happens with that is there's a specific brand and a specific size that they have to wear for it to be effective, because it blocks everything. It fits very closely and carefully. The next level down is sort of what you've seen are the surgical masks, and these are sort of the disposable masks that a lot of people are wearing. They are not as good as the N95s in terms of total screen out, but they do, in most settings, hospital settings, unless you're dealing with an infectious disease, are sufficient to protect both the people that you're taking care of and yourself. Now, what we've discovered with what we're calling face coverings, some people call them masks, and there's all different varieties of them, right, that people are wearing these days. There are, I don't have the video with me, but there's a video that shows how far stuff spreads when you talk without a mask. There's two people, and it shows they're 6 feet apart, and it shows how far that spread of droplets is. The next one is the two people with one person wearing a mask, and it shows how far the spread is with one mask. And the third is the two people with both having a face covering on, and it shows the very limited spread of those droplets, very limited. And so what we know is a face covering is definitely better than nothing at all. Definitely much better than nothing at all. And face coverings, whether it's a cloth mask, a homemade mask, a bandana, that people are using all sorts of different things. It really doesn't make that much difference. There are people selling masks that have an extra filter in it. There are people selling masks that have copper in it, and there's some belief that some of these things decrease the risk of spread a little bit better than just a plain cloth mask. But again, for most people, that cloth face covering is going to be more than sufficient to help you day to day. As long as you're washing it daily. If you wear it daily, you ought to wash it daily, and let it dry completely before you wear it again. That's pretty important, because it does get saturated some as the day goes on, as you breathe in and out.
Thank you so much.
Mm-hmm.
I think Eliza has a question next.
So if we go back to school, if we're able to go back in person, are we going to be able to provide masks for children, or do we have the resources to do that?
So actually, the governor announced yesterday that he was going to be providing 5 masks for every student in North Carolina. The school system, and this is one of the things that the EOC does for us, the Emergency Operations Center and Emergency Management, is they have a whole logistics section that helps us order things that we need and get back into the county. So that process will happen through there. So the school system here has already let them know how much they need. And that order is going up to the state. And what we've been finding, I don't think he would have made that promise if he didn't think he could get that here very quickly. So probably what will happen, I would imagine, if they do decide to open schools, is that first day as students come back in, they'll get full 5 masks. So they'll have one for every day of the week.
Great. I think Jess has a question.
Hi. So on the kind of a fact versus fiction, social media has definitely been a big source of false information and biased and polarized data. So what can we as if you have any recommendations, what can we as teenagers do to kind of minimize that and lessen that effect?
So there are a couple of things that could be helpful. If you go to the Mecklenburg County website, there's a handful of toolkits out there that have social media messages that y'all can use that are fact-based. And they're in English, Spanish. We're trying to get them in some other languages. That would be helpful. And if you see a message that you think is just really inaccurate, counter it with factual information. I think social media sometimes is really good for us and sometimes is really challenging because there's no way to control what goes out on it. You don't want to control it. That's what social media is all about. But at the same time, we really want there to be factual information out there. So those toolkits are on the website and readily available to you to use with a number of different messages that you can put out. And we'd appreciate your help with that.
Great question. I believe Tanushree has a question.
Yeah. So what is your advice for athletes taking part in fall sports, especially the school teams?
That's a toughie. We have opened up a number of sports because they aren't considered contact sports. So playing tennis, playing golf, possibly even volleyball, but things like basketball and football where there is a lot of contact, it's hard to keep people safe. And I don't know if you've seen, but there's been a number of both college and pro teams that have had outbreaks after they've started back with practices. I have been involved in conversations with the Panthers about what they're going to do, and they're bringing people in, they're testing them, they are on a fairly regular basis. They're also sort of quarantining them in hotels while they're practicing. And you can't do that in a high school, or in many cases, you can't even do that in a college. It's just harder to do. You know, if there are conditioning exercises that can be done as a group and things like that outside that people can do without, it's the practicing part where they actually start having contact that seems to be part of a challenge. So I know that that's hard for folks not to be involved in, and we see evidence of that every day in the parks and other places. But it does put people at risk.
Thank you.
Mm-hmm.
Thanks, Director Harris. I believe Anusha has a question as well.
Hi, Director Harris. Jess brought up a good point earlier about the misinformation that's been floating around on social media, but I was wondering what the local government was actually doing in terms of dealing with people who, for example, don't want to wear masks in public places despite the governor's order. How would we apply that to when school reopens in the fall, if it reopens on a certain plan? If certain parents don't want to send their kids to school with masks, or if certain parents don't believe in following certain guidelines.
So what I understand from working with the school staff is their protocols are you don't come back to school unless you have a mask on. The expectation is that all kids now, in the beginning, the early potential guidance that the governor put out said middle school and high school for masks, did not include elementary, but because of the research that's been done and what we know about it since then, he's added elementary school kids to that as well. So if you don't wear a mask, they will be sending you home. It's as simple as that. It's easier to control that in the school setting than it is in some of the restaurants we've seen, social media, the sandbars out on Lake Norman. I get these videos every weekend showing me what's going on in the community. And there's a couple of challenges here. Number one, the governor's orders, like I said, have to be a little broad, and we've seen different businesses and others who have taken advantage of that and tried to manage through some of those loopholes so that they can do what they want to do. And the other challenge we have is that the only entities that can actually enforce are law enforcement. You know, we have health inspectors that go into all the restaurants and inspect them from a food safety standpoint, but we don't have the authority to shut them down because they're not wearing masks. That's just not in statute. We don't have the authority under law to do that. So it requires law enforcement to do that. And there's no way law enforcement can enforce mask wearing for individuals, you know, in a county this size. But they are going out. I get complaints on email all the time about this gym that opened up or this bar that's doing this or something like that. And I have a contact at CMPD and I send them the information. They send an officer out to make sure that folks understand what they can and can't do, and then we'll enforce if they have to. So it's a challenging situation. I mean, especially considering some of the civil unrest and the protests that are going on. you don't necessarily want law enforcement getting in somebody's face and telling them they have to wear a mask. It could incite other issues, and we just don't want to go there. We just need people to do what we're asking them to, because it's the right thing for them to do. So we need everybody's support in helping us make that happen.
Yeah, definitely. I think Aditi has a question next.
Hi, is COVID-19 transferable through objects? So if someone with the virus touches an object and then you touch that object, are you at risk of getting the virus?
So we do know that the virus can live on objects for short periods of time. This virus it needs a host, right? It doesn't like inanimate objects. So it will not last for a long time on a surface, but it will last on a surface. And that's why we say you need to be cleaning surfaces on a regular basis. And if you're in a position where you're doing something on a surface that other people are using, just making sure that you're cleaning it. So if, say, example, you work somewhere and you're running a cash register, or if somebody else just got through using it, you want to wipe it down before you use it. It's just to be on the safe side. But in terms of, if you come back the next day, yes, you need to clean it, but there's no chance that virus is going to be living at that point.
Thank you.
Mm-hmm.
Great question. I believe Jess has a question again.
So, this is about schools opening. Is there like a concern that there's going to be like an inequality created with schools opening? Like if one school comes on with a big amount of cases, or like one school has like a bunch of teachers go out, is there a concern that that's going to kind of create an uneven playing field in schools?
Yeah, that's a good question. I don't know that that's been part of the conversation at this point. And some of the questions I got tonight were, if a teacher tests positive and everybody in the room was wearing a mask and everybody in the room was social distancing, do we have to close down the whole room? And my point to them was, it depends on a lot of different things. Were they infectious when they were in the room? So if a teacher tests positive on Monday, but they've been away all weekend from that class, probably not. If the teacher was asymptomatic, never had symptoms but tested positive, we wouldn't worry about that one as much. But if that teacher was symptomatic and in the room for 8 hours with those students, we'd be more concerned about that. But the likelihood that we would have to close down a whole school is probably pretty slim. We may have to, we may have students that may have to do virtual learning a little, for an extra week, rather than be in the school setting, to make sure that they're not infectious. But every situation is going to be a little bit different. But I do understand what you're saying about whether that creates challenges for students in that school as opposed to what's happening in other schools. As I understand it from the school system, they would be looking at virtual learning during that time frame. So not stopping completely anyway.
Thank you. I believe Rowan has a question.
Hi, so I know you mentioned earlier concerns over like the upcoming flu season coinciding with COVID. So do you suspect, I know this might not be something you can answer, but do you suspect that like COVID precautions and testing will be administered widely to all who enter the hospital during those times, or do you think that there will be lengths taken to separate the two?
So I think we're in the process of sort of working through some of those plans. A lot's going to depend on where we are with testing for COVID at the time. As we think about opening schools back up, I would love for us to have rapid testing available, so that if a child comes to school and has a fever or has some symptoms, we could pop them with a test right there, and within an hour know whether they're positive or not. And the same with a teacher. And that can help us manage things so much better than what we're dealing with right now with test results. The biggest challenge we have with testing right now is the availability of testing. It's just not as readily available as it needs to be. And the turnaround time on test results is not as quick as it needs to be. I know they're working on that, and I know they're hoping to have more available in the next month or so. It would be great to have that rapid test. You know, we have a rapid test for flu. You go in, you get tested, you get your results back in 15 minutes. If we could have the same thing for COVID this fall, that would simplify things hugely. But the other thing that will help is for everybody to get their flu vaccine. I need everybody to get immunized this fall. And I know there are a lot of people that don't like to do that, but I think this year it's going to be particularly important. And we're working with the CDC in the state to make sure that vaccines are readily available. So I think it's just going to be challenging having two respiratory viruses that are very contagious and can make people pretty ill going at the same time. It's just going to be challenging.
Definitely. I can't even imagine what it'd be like in your role right now.
There are days.
Definitely. Well, thank you so much for your work, honestly. I believe Kia has a question next.
Yeah, hi. So I was wondering if CMS is planning to send health inspectors to schools to make sure that they're following through with the policy if we go back to school.
I think she might be frozen, so let's give a little bit of time for her to reconnect.
She'll probably rejoin us soon. But for everyone who has questions, just keep them in your head or on your notebook. But hopefully we'll get her back in soon.
Yeah, these are really great questions so far. Keep up the good work.
And I'm taking notes on the answers, so if you guys want to come back to them, you guys have access to this document. And is she not still in the way? Is she not in the waiting room?
Not as of now.
Okay, we'll give her a couple minutes.
Yeah.
You know, Wi-Fi.
Probably just a Wi-Fi issue.
Yeah. But thank you all for coming. I'm really excited with how this is going so far. She's great, and we are so lucky to have her on the call with us tonight. It's not every day you get the face of the public health initiative for a global pandemic from your county. Like, that's something really cool, and keep these questions coming because you may not ever get a chance to talk to someone as cool as Gibby Harris again. So this is really awesome.
Definitely, especially when she has obviously so much work to do. The fact that like she's taking the time out of her day, of her very busy day, given that she is like the face of public health in this pandemic in this our county, to talk to us is really incredible, and we're like really lucky to have her today. So definitely please take advantage of her time.
And if for some reason we can't get her back on, I think it would be a great idea for you to send us your questions that you have lingering, and maybe we could type them up and get them over to her and just see if she'd be willing to answer those questions.
I know a lot of you are high schoolers right now, and so if you were considering an area of study, Gibby Harris is an
Okay,
MPH,
she
so
entered the waiting room. Let's do this.
let's admit her.
Okay, awesome. I'm going to admit her back. Kia, would you like to re-ask your question?
Hi. So,
Oh, Director Harris, I think you're muted.
Okay, can you hear me now?
yeah.
Yes.
Okay. Yeah, our county system has been having trouble with their VPN and it kicked me out. So I apologize for that.
No worries, no worries.
So now I'm on my phone. So I think the question had to do with health inspectors visiting the schools to make sure that they were being compliant with their protocols. Typically, we are required by the state to visit the schools once a year to check for sanitation and other issues. But I think this year we're going to have to, if they do open schools this fall, we will probably be visiting more often and providing guidance and support. The other thing we do is with our school nurses being in the schools, they're able to monitor as well, and we can address issues as they come up.
Great. Thanks for making the effort to get on your phone and join.
Well, it was just all of a sudden everything went blank, and I was like, not good. And now I see it's back up, but that's okay. I'm on the phone. It's all good.
Awesome. Well, let's just keep going along then. I think Tanushree has another question.
Yeah. I'm not sure if you can answer this, but how can we like identify if we're like asymptomatic, and like what precautions can we take?
So again, if everybody is masking and social distancing, then there's less chance of transmission, even if you're asymptomatic but infected. And the other thing to pay attention to is if you know you've potentially been exposed to someone, then the recommendation is that you go ahead and quarantine. The problem, lots of people, as soon as they find out that they may have been exposed to someone who was positive, is they want to get tested right away. The likelihood that that test is going to be accurate within the first 5 days is slim. So you need to wait at least 5 days. So if you think you've been exposed and you know someone's positive that you've been around and there was the possibility of no masks and you were in close quarters for a period of more than 15-20 minutes, then you need to consider quarantining until you can be tested.
Thank you.
Mm-hmm.
Great question. I think Mona has a second question.
Hi, yes. I was wondering, how safe is it to order food from restaurants or order takeout? Is it?
Yeah, we found that to be very safe. Our environmental health specialists have continued to visit those restaurants to make sure that they're doing things the way they need to, and we found them to be very compliant with all of the different things they've been instructed to do. So I feel good about, as long as the food is safe, and that's one of the things that we have to do, is make sure that their food processes are safe and doing what they need to do to make sure that they maintain the right temperatures and cook things well and all of those sorts of things. Then that's why it's important to check to make sure they've got a decent score from the health department before you actually eat at a restaurant.
Okay, thank you.
Mm-hmm.
Next up, I think we have Aditi.
So I was wondering what your response is to the politicizing of COVID-19, and has that had any impact on your thought process or how you make policy?
So, we've talked about this before. Typically, emergency situations don't last long enough to get terribly political. COVID-19 has lasted way long enough to become incredibly political, and it does not help. It has influenced the messages that have come out in a way that's not helpful. It's confused people about what they should and shouldn't be doing. And it has made a difference in the availability of resources that we need to combat this virus. I have, some people believe, based on some of the emails I get, that I am political in my decisions. And I try to make sure that decisions that I make and recommendations that I make are fact-based and science-based. I try to leave the politics to other people, because that's not going to help me get my job done. Of course, I've got my own political opinions, but I try not to bring those to work with me.
Got it. I think Eliza has a question next.
So as schools begin to reopen, is there going to be like a struggle with being short on faculty members if teachers are either afraid to go to work, or if they're showing symptoms and they have to stay home, or if their subs are afraid to go to work too? Is that going to be a problem as the school year starts?
That's a great question. And I think that's been one of the concerns that I heard from the school board tonight. They have heard from lots of teachers and people that work in the school system that are afraid to come back. You know, especially if you have older people that have health conditions that puts them at high risk. Those are the ones that are most fearful. But then there are those people who are afraid of taking something home to their family. And so, you know, I'm not sure how that's going to influence the school board's decision about whether to open up or not. I'm sure that'll play a part in their decision making. I don't know that the school has actually done a poll to see if there are people that would not come back to work. And I guess we'll have to see how this plays out a little bit. But I think we have to have the right amount of staffing support and teachers in the schools to make it effective if they open back up. And if we don't have that, it's going to be difficult, because the temptation is going to be, I think, to double up on classrooms and things like that. And that's not what we want to see. So we're opening schools, not opening schools, whichever way we go with it, it's going to be a big experiment. And I have encouraged the school system and anybody that I talk to that's considering opening up to have options, you know, to have multiple plans to be able to address whatever situation we find at the time that they're thinking about doing it.
Great. I actually have a question for you.
Okay.
What would you say to people who believe that, like, being forced to wear a mask in public is kind of a violation of their rights, and that the closure, or at least temporary closure, of businesses like bars and restaurants are unfairly targeted against them?
Yeah, that's a tough one. And I've got to tell you, public health in general is constantly walking a tightrope between the needs and the safety of and the health of the community as a whole and the rights of individuals. We do that every day, not just in COVID. We do that with HIV, we do that with TB, we do that with STDs, we do that in all kinds of different issues, because we are charged with the health of the community. So I consider the community my patient, right? But at the same time, I have to consider that individuals have rights, and we want to make sure that they're supported in the best way we can do that while we're protecting the community. So I understand people's concerns about that, but at the same time, there are times when you have to do things you don't want to do because it's good for more than just yourself. And so I don't buy into that argument. I think that it's a sort of a narrow-minded way of thinking because what you do impacts others, and we're all part of this community. So it concerns me when people think that way. So I think they need to wear a mask.
Right. Awesome. Thanks for answering the question.
Absolutely.
I believe Kia has a question.
Yeah, so I was wondering that, like, once the governor releases a policy, do you believe it's set in stone, or depending on how the cases rise or lower, the policy could change?
I think all of our policies, our protocols, how we're operating these days has to be fluid. We have to be willing to look at the epidemiology in Mecklenburg County. And, we're not an island, right? We sit right on the South Carolina border, and things are not good in South Carolina right now. But we also have multiple counties around us, and people come into our county from lots of different places for lots of different reasons. We've got a busy airport. People are flying in and out. So we can't just think, that we can just do things our own way. But at the same time, we've got to look at what's happening here and make decisions based on that. And that means sometimes we have to slow things down more than others might. That means we may have to stop doing some things that others might be able to do because their numbers look different. And that's the reason why I think, I'll give you an example. Talking to the Panthers would love to bring 28,000 people into the stadium, socially distanced, for a Panthers game in August. And I said, go ahead and develop your plans because eventually they may be useful to you, but don't necessarily believe that you're going to be able to do that in August. You need to have a backup plan. So everybody's got to have a backup plan. The schools have to have a backup plan. The county, in terms of when we bring staff back in to provide service, we have to have backup plans. And we have to be willing to reassess those plans based on what's going on at the time.
Thank you.
You're welcome.
Before we continue, Director Harris, we do have a couple more questions, but I understand that we are nearing the 7:30 mark. So we were wondering if you had a little extra time just to answer a couple more questions from our cohort members.
Sure, I'll be happy to.
Awesome, thank you. I think Anushka has a question.
Hi, so I have a dog at home, and a lot of people say that like dogs can't catch corona, but then I saw in the news that dogs can spread it. So I was just wondering, how do animals play a role in COVID-19?
I know that we've seen several instances where animals have been infected, but doesn't seem to be widespread. You don't hear about it often. And, if you've got a household with numerous people in it and there's pets there as well, and everybody in the household's infected, it wouldn't surprise me if the animals weren't infected as well. I don't know that we've got a real good picture of what that infection looks like in a dog, but it doesn't seem to be a significant issue for them if they become infected. And I really have not read anything or found any data that talks about how they may be contagious to humans. I think it probably goes the other direction is what I'm seeing so far. So again, rare, based on the data and the information that we've got at this point.
Great. I think Mona has a third question.
Hi, sorry, this is my last question.
That's okay.
this is a bit extreme, so I'm not sure if there are any answers for this, but recently you might have heard in the news that the bubonic plague, that a squirrel had the bubonic plague and a boy in Mongolia also had it. So do you think that these, there are only like 2 cases, but do you think that in the future the plague might affect future COVID-19 protocol or precautions?
I can't specifically speak to the bubonic plague, but I will talk about viruses in general. We have seen a number of epidemics, not pandemics, but epidemics over the last number of years. We've had SARS, we've had MERS, we've had Ebola, now we've got COVID, and I think what we need to be prepared for is the possibility of more situations like this as we move forward. I think we are a very mobile world where viruses can spread easily. There seem to be the ability of these viruses to mutate and to create more problems for humans. So this is a whole area of study, and there are people that are looking at this all the time. But I anticipate that we'll see more spread of other types of viruses as we move forward, and hopefully we're learning from COVID on how to better handle that so they don't get to the pandemic level. But what that tells me is that, we have, these issues are worldwide issues. They're not specific to any one country or any one group of people. And it's important for us to have organizations like the World Health Organization that help pull us all together and help us think about how we address these things as a world, as opposed to each country trying to do their own thing, because I don't think that's going to be as effective as we move forward.
Thank you so much.
You're welcome.
As our final question, I think we'll go to Dia.
Hi, so I had a question about the vaccines. I'd heard, that they've been saying that vaccines would come out around December or January, but I've also heard that the COVID-19 could also stay and kind of be like the flu and just mutate every year. So in your professional opinion, what do you think would be more likely? Do you think the vaccine is close?
I think that we will have a vaccine. We'll probably have more than one different kind of vaccine because there are lots of folks working on it. And, the question will be, how effective will it be? How many people will take the vaccine, right? And just because we have a vaccine does not mean that COVID-19 doesn't continue to exist in our environment. So the possibility of it coming back in the fall or having some sort of season like flu does is probably a pretty good one. And it may be at some point where we have a combined flu and COVID-19 vaccine. That's just speculation on my part. But the problem with viruses is they're really wily. They're really smart, and they mutate and they change to adapt to their environment so that they can do what they do best, which is infect people. So we'll have to watch this virus and see what it does moving forward. It does look promising that we will have a vaccine of some sort early in 2021. That's amazing. Vaccines usually take years to develop because of all the different processes they have to go through in terms of finding out if they're safe, and then find out if they're efficacious, and then find out who they are efficacious for. And I mean, there's just all sorts of layers, and this is moving really, really fast, which is good news. And I'm hoping that the ones that they're starting to work, that they're in the middle of working on right now, are going to prove to be effective, and that people will take them. I mean, that's the other problem that we have.
Thank you.
You're welcome.
All right, I think that's wrapping it up for now. It means so much that you were able to come to us, Director Harris. Not only did you accept this as probably the busiest woman in Mecklenburg County right now, but that you stayed to answer a couple of questions after 7:30. So that means a lot to us.
Well, I appreciate the opportunity to talk to the group, and I appreciate the work that you're doing. It's quite impressive, and anything I can do to support that, you let me know. We need more groups like yours to do that work. So I'm happy to be available to you anytime that would be helpful, and sorry for the technology glitch in the middle.
It happens to all of us. And thank you to the cohort for being able to make it tonight too. Everyone is free to go.
And I would imagine that the school meeting is still going on if folks want to get on and see what the decision's going to be. I know some people are interested.
Yes, thank you.
Okay, great. Y'all have a wonderful evening.
You too.
You too.
Thanks.